dear students, we can continue with our IV infusion sets. Next we can see the gravity tubing. So gravity tubing is mainly, its action is mainly depends upon the gravity and also some of the flow rate regulators are there, and it is also depending upon the flow rate regulators also. And we can adjust in the regulators, we can adjust the drops per minute. Drops per minute means how many drops of the particular medication has to be infused in a minute. That rate can be set in that regulators. So in that way or in that speed, the flow of the medication will be infused. Okay. So that drops per minute is equal to millimeter per hour infusion rate. So this millimeter per hour is equal to the drops per minute. So both rates are equal. Then example, dial a flow tubing with a gravity infusion. The bag is hung on a pole above the patient and gravity creates a pressure required to deliver the medication. So one of the example for this gravity tubing is dial a flow tubing. So that based on the gravity or under the gravity, the bag will be hung on a pole just above the patient, and due to the action of gravity, it creates a patient within the tubings, and so that pressure is required for delivering the medication to the patient. Then flow rate of IV set. How will be the flow rate, or how we can regulate the flow rate of IV set? So when using this IV administration sets, we can adjust the flow rate to be faster or slower depending on the medication which is infusing and prescription orders. So there are some of the medication which has to be administered in a slower way, such as in case of some of the antihypertensives, then cardiac medicines and all, it needs some cautious matters. So in case of such medications, that medication has to be infused in a slower manner. But in case of some of the medications, or in case of hypotension, patient is having any hypotension and all, then we should administer some of the vasoconstrictors and all. So for that medicines has to induce into the body in a rapid rate. So in such cases, the medicine has to induce into the body in a faster way. So based on the condition of the patient or based on the type of medication, we have to control the speed or infusion rate. Okay. Then so that infusion rate is known as flow rate. This flow rate should be controlled by the nurse as per the doctor's prescription orders only. Then height of the bag. How we can adjust the height of the bag for proper infusion? When it comes to gravity infusion, the height of the bag directly impacts the amount of pressure being put on the line. The fluid may be infused more quickly. So for the action of gravity, the height is very much essential, because the height of the bag impacts the amount of pressure that is being applied or put on the line of the fluid, so that the fluid or liquid or medication can be infused very quickly. Okay. And then the infusion rate can also be impacted by the position of the patient. Another thing that affects on the infusion rate is the position of the patient. So if the patient is lying down or sitting position, the infusion rate could be potentially slows down. And after connecting or after starting an infusion, a nurse will periodically check whether the medication is infusing in a normal flow rate, or if any blockage is there, or if any obstruction is there in the infusion bottle, medicine bottle, and also that is why, because the position change, any position change of the patient can affect the flow of the medication. So that for avoiding that complication or error, the nurse can periodically check the patient's infusions. Then based on the flow rate, there are two types of drip sets, micro drip set and macro drip set. So what is the difference between these two? Okay, a micro drip tubing is used for patients who are receiving smaller amount of intravenous medications. For patients who are receiving only a smaller amount of intravenous medication, we can use a micro drip set. Then macro drip set means macro drip tubing is very much larger. Okay, and so it is better for delivering larger doses of fluid. Instead of using this micro drip set, those patients who need a larger volume of medication, we can use this macro drip set. Then micro drip tubings typically delivers 60 GTT per ml, which means it would deliver 1 milliliter in 60 drops. So 60 drops of a micro drip set contains 1 milliliter. So 1 ml equal to 60 drops. That is the meaning of micro drip tubing. Okay, 1 milliliter is equal to 60 drops in case of micro drip set. As in case of macro drip set, that can deliver between 10 GTT per ml to 15 GTT per ml. So which means it can deliver, the macro drip set can deliver 15 drops of the fluid, 15 drops of the medication. So 1 milliliter will be equal to 15 drops. So that is the meaning of the flow rate of these two, that is macro drip set and micro drip set. So the drop size in the micro drip set will be very smaller, but in case of macro drip set, each drop is having larger in size. Then this is the two different drip set. Here this one is macro drip set. Here the size of drop is very large, and this is the micro drip set. Here the micro drops are coming from this area, and the size of the drop is smaller than the macro drip set. Then next we can discuss regarding parts of an infusion set. So here an infusion set is given. So this is the vent. We can control this the air pressure within the tubings by opening this and closing this. And this is a spike. It is a covering of the here there will be a covering for the spike in order to avoid any contamination. And the spikes has to be inserted into the bottle of the medication. Then this is a chamber, solution or drip chamber, and here there will be a filter which will filter the potential contaminants from the medication. Then this is the tubings. This all are the tubings, and this is the roller clamp. By using this roller clamp, we can regulate the medication flow rate of the medication. And here this is the part that is we are connecting with the patient, and here there will be needle, and this needle has to be removed, and this connector has to be connected with the patient's IV axis. And this is the injection sites through which we can inject any kind of medication just in between the IV infusion time. Okay, so these are the important parts of a infusion set. The next we can see fluid rate calculation. How we can calculate the fluid rate. So in different drip sets, that is for micro drip set and macro drip set, there are different formula. So it is mainly both are same equation, but the flow rate is mainly depends upon the drop factor. This is known as drop factor. Drop factor means 1 milli, how much drops creates 1 ml of medication. That is a drop factor that we have discussed earlier. So in case of micro drip set, we have already said that 1 ml is 60 drops. So that is the drop factor. So the equation is total